Muy buenos días a todos. Gracias.
Hello, good morning to all. Thank you for joining us in this press briefing by PAHO on COVID-19 in Latin America. My name is Sebastián Oriel. I am with the Communications Department here at PAHO, and this session will be between 45 minutes and 1 hour long, and we will be accepting your questions up to the end. We have already received some questions via email. You will also be able to send your questions using the Q&A button, and we will also be accepting your questions live. And first, please send us a message through the Q&A to be able to coordinate. Please do include your name and your media outlet when sending your questions. Let me remind you that we have simultaneous interpretation into English and into Spanish, and you can choose that by pressing on the interpretation button. Today, Carissa Etienne, Director of PAHO, will be reporting on the current epidemiological situation of COVID-19 in the region, the latest trends, and she will also be sharing examples of countries in the region that have offered an efficient response to COVID-19. Jarbas Barbosa is with us today, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of the Health Emergencies Department with PAHO, Dr. Marcos Espinal, Director of the Department of Communicable Diseases with PAHO, and Dr. Sylvain Aldigueri, Deputy Director of the Emergencies Department and also Incident Manager for COVID-19. Now, I would like to invite Dr. Etienne for her opening remarks. Dr. Etienne, you have the floor.
So, welcome again, and thank you for joining this week's briefing on COVID-19. As of August 24th, there have been more than 12.5 million cases and almost 450,000 deaths due to COVID-19 in the Americas. The United States of America, Brazil, Colombia, Peru, Argentina, and Mexico remain among the 10 most affected countries globally. We have grown accustomed to the impact of this pandemic, and the numbers reported week after week can indeed leave us numb. But we cannot remain passive in the face of such devastating human loss. We must follow the numbers and use them to guide our response. The region of the Americas has one of the most robust surveillance systems in the world, the result of our long history fighting infectious disease and the deep collaboration among countries that this requires. Since the pandemic began, PAHO has been working with health authorities at every level to track data on COVID-19 to form a clearer picture of our strengths and gaps in the fight against the pandemic. PAHO uses this data to help member states tailor and adjust their public health responses to counter the virus. Over time, we analyze the data to better understand how the virus spreads, why it affects some people more than others, and what works best to stop it. So today I'd like to share a few observations from the latest data that we have available, as it provides a sense of where we are and where we're going in the Americas. So let me start with a few things that I'm concerned about so I can leave this with you. In the past 6 weeks, deaths in our region have doubled, and the number of new COVID-19 infections reported has more than doubled, rising from 5.3 million on July 1st to almost 12 million cases today. Data trending in that direction typically signals an urgent need to implement public health measures to slow the spread of COVID-19, such as social distancing, sheltering in place, and limits on public gatherings. Yet, over that same period, the very opposite has happened. Countries have gradually relaxed restrictions, resumed commerce, and some are gearing up to head back to school. In far too many places, there seems to be a real disconnect between the policies that are being implemented and what the epidemiological curves tell us. This is not a good sign. Wishing the virus away will not work. It will only lead to more cases, as we've seen over these past 6 weeks. Indeed, local health authorities have a central role to play in generating and analyzing data to adjust public health measures to their reality and the reality in each area. I am also concerned with the disproportionate incidence of COVID-19 in younger people. Our data show a similar pattern all over the Americas. The vast majority of cases reported are among people between 20 and 59 years of age. Yet, almost 70% of deaths occur in individuals over 60 years old. This indicates that younger people are primarily driving the spread of the disease in our region. Many young people who contract the virus may not become ill or require an ICU bed, but they can spread it to others who will. So this is a stark reminder that defeating COVID-19 is a shared responsibility, not only among countries and regions, but between people, neighbors, and communities. If you don't take the right steps to keep yourself safe, then you're putting others in danger. Finally, I want to share concern about new infections in the Caribbean. During the first months of the pandemic, virtually all Caribbean island countries and territories have avoided major outbreaks thanks to strong political resolve and a smart mix of public health measures. But now that non-essential air travel is resuming across the region, several countries are reporting spikes in cases. 2 weeks ago, the Bahamas observed a 60% increase compared to the previous week, while St. Martin, Trinidad and Tobago, and the US Virgin Islands all reported a 25% jump. This is not just driven by tourism, but also by citizens who are returning home after the lockdown. We know that countries that depend on tourism cannot remain closed indefinitely. But as they reopen, they must use all the resources available to reduce risk for their population. However, there are also encouraging signs in the data, proof that countries have the tools to reduce the spread of COVID-19 and to save lives. One of the most effective strategies we have is contact tracing. The Bahamas, for example, despite having to deal with more cases now, are working to stop the chain of transmission by using contact tracing to track all new cases and limit the spread of the virus. Argentina, Guatemala, and Suriname were also able to keep transmission low early on. This bought them the necessary time to prepare the systems for this moment, and they've built the necessary capacity to identify cases and trace people who may have been exposed. Dominica used its long-standing primary healthcare approach and its well-established first level of care to promote and support public health measures, ensuring aggressive contact tracing, quarantine, case identification, and isolation. There are other examples of how the right strategies can indeed bend the curve of the pandemic. As recently as June, infections in Chile were rising rapidly. So national authorities looked at the data and tailored the approach, drastically expanding testing, isolating cases, and deploying stay-at-home orders in the hardest hit areas. It worked. For 6 weeks now, Chile has seen COVID-19 lose steam and is reporting fewer cases. Costa Rica, on the other hand, had low transmission when they implemented stay-at-home orders and used that opportunity to prepare by expanding testing and hospital capacity. Even though there are new cases now, their health services are coping well. These few examples prove that if we employ evidence-based approaches, we can eventually overcome this crisis, even in places where cases are rising. So this virus is going to be with us for a while. Without a vaccine, it is going to be with us for years. This will not be a fight that we win once, but one that will go several rounds. That's why we need to apply lessons from places that have controlled the virus and let data guide our action. We can't stop all transmission, but if countries stay vigilant and expand testing and surveillance, they can better identify spikes in cases and act quickly to contain them before they spread out of control. In order to do that, primary healthcare should be at the center of the response, identifying cases, acting to contain transmission, and providing timely care in the community. We have good tools today. Data that show where the hotspots are, contact tracing protocols to slow onward transmission, and public health measures that can reduce the risk of exposure. We'll have even better tools in the future, improved tests, more effective treatments, and even vaccines. National and local governments need to be strategic about how they use these tools, old and new, to achieve the desired impact. And they don't have to do it alone. PAHO has shared criteria to guide its member states and works closely with our policymakers to help them balance public health measures with economic realities. As I've said before, a healthy economy requires a healthy population. It's not only possible to implement sound public health measures alongside social and economic policies, it is necessary so that we enable countries to function safely for as long as the pandemic lasts. We are in this for the long run, and we must do our best to protect lives while keeping our societies strong. Thank you, and over.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. Now we are going to start with the questions that we have received via email, and then we will be accepting the questions via chat. And please remember that you can send the question through the Q&A button, and you can send them in English or Spanish. And let me remind you to identify yourselves with your name and also media outlet. The first question is by Julieta Rojo from Clarín, Argentina. She would like to know your recommendation for exiting a long confinement period, such as the one that we have had in Argentina, without triggering the transmission, and they have had 160 days of lockdown.
As I said just now, we are in this for the long run, and we must do our best to protect lives while keeping our society strong. As we have said repeatedly, this pandemic has forced us to address 3 emergencies at the same time: health, social, and economic emergencies. And to be successful, we need a joint approach, one that allows us to keep a balance and to save lives. So national and local governments must let transmission dynamics establish their timeline for reopening. The goal is to flatten the curve and then to bend it downwards significantly before relaxing any restrictions. Transmission in an area should be going down in a sustainable way. Deaths should be decreasing, and hospital bed occupancy rates should be low. The key is to think both nationally and locally, and to base decisions on the latest data. Reopening is not merely suspending travel restrictions and stay-at-home orders. It requires implementing a set of public health measures to track new cases and to build sufficient capacity to detect and control new outbreaks. So these steps include contact tracing, and this should be in place wherever possible, anchored to a strong primary healthcare system that can help reduce the risk of transmission among vulnerable communities. We must ensure that the number of hospital and ICU beds remains sufficient to provide care to severe cases. Ample access to timely testing for every suspected case and their contacts is also necessary. The isolation of cases, access to information, and PPE for healthcare workers are essential. Considering implementing travel-related measures that must be adapted to each context. We also need to proactively address the inequalities in our region that limit the access to health services for so many people. The most vulnerable will need economic and social support to enable them to protect themselves and, importantly, to stop the chain of transmission in our communities. And then there is what we as individuals should do when there is a reopening. We should carry on with preventive measures, using masks, keeping social distancing, washing our hands frequently, etc. So reopening does not mean that the fight is over. Communities must remain open and will only be able to remain open if each one of us does our part. Thank you so much.
Gracias, doctora Etienne. La siguiente pregunta.
Thank you very much, Dr. Etienne. The next question is by Francisco Moreira, also from Argentina, covering news. Do you think that the drop in the age of transmission that we are seeing in the second wave in Europe is the next step also here in the Americas? And could we say that here in the Americas we are in the first wave, or is there a differentiation among the countries? Dr. Espinal. Thank you very much, Francisco, for such an important question. And the analysis carried out by WHO over more than 6 million cases that were reported, we have already seen that the pandemic is affecting younger groups, not only in Europe. The director also just mentioned that in our region, that is the case. But I think that the region has the opportunity to learn from the lessons in other areas. We should not forget that this started in Asia, continued in Europe, to later on move to the region of the Americas. So it is important to take into account the possibility of a second wave. This is something that is there to be addressed. It could happen. Now, in connection with the second question as to whether we are in the first or second wave, we do have some differences based on the countries. We see some countries that are having a high incidence of cases, such as Argentina. We have also seen that Costa Rica had some spikes, but there are some countries, such as Uruguay and Chile, that were able to flatten the curve and report fewer cases. Even Brazil is showing a downward trend. But it is important not to think that because we have a downward trend or we are flattening the curve, this will continue. We do not have a set calendar with this virus. There are many questions that remain unanswered, and we can never discard the option of another wave. We should congratulate those countries that are doing it well, but we should continue with those measures. When a decision is made to reopen or to ease the measures, caution should be exercised, and the director already mentioned all the measures that need to be implemented so as to detect a second wave and also to avoid an impact such as the first one that we had with the first wave. Thank you. Thank you, doctor. The next question is by Melina Ochoa from Uno TV in Mexico. What is PAHO's opinion as to the discovery by a group of Hong Kong researchers of the first reinfection case of SARS-CoV-2 in a 36-year-old, and the possibility for the next vaccine to also be applied to people who were already infected. Dr. Aldiguieri. Thank you very much for that question, which is very important. In principle, we need to be very cautious with the screening and also the interpretation of emerging information. But in this case, the researchers have already published an article with a good deal of information. We need to establish a difference between two clearly different situations: a relapse of the infection in the same patient, such as a reactivation of the virus, but it is the same virus from the genetic point of view. And a second situation, a second scenario, that would be a reinfection with a virus that is genetically different. The Hong Kong article is very clear. The researchers sequenced the genome in two different viruses, and this would be a reinfection. What is the impact of that finding on plans to introduce vaccines? First, that highlights the importance of genomic surveillance of the virus. It becomes even more important. Second, the viruses change as time goes by, and a vaccine may perfectly grant immunity for a portion of the virus that does not change. So I go back to my comment. The genomic surveillance of the circulating viruses is key to inform and work on the introduction of the vaccines and the development of the vaccines at this point in time. Thank you. Thank you very much. The next question is by Juan Manuel Nievas from Shinshua. He's saying Argentina will be producing for Latin America, together with Mexico, the COVID-19 vaccine that was developed by AstraZeneca and Oxford. What is your assessment of this joint manufacturing? And also, Argentina authorized early trials of the Chinese vaccine. What do you think of this cooperation between both countries? Dr. Barbosa, thank you very much for this question. First of all, in connection with clinical trials, it is very important for countries in Latin America and the Caribbean and throughout the region that have all of the regulations to carry out clinical trials and that also have experience to be able to participate. This is going to be a very important ally to have phase 3 trials completed over the next coming months, and also to have answers to all of the questions. PAHO is providing technical assistance to those countries that need it, so as to evaluate the protocols and guarantee all of the ethical and technical aspects of a clinical trial. So this is important. Participation is important. As to the production that was announced between Mexico and Argentina for the AstraZeneca vaccine, we think it is very important. The AstraZeneca vaccine is one of the vaccines that is part of the basket of vaccines under COVAX facility that already has 30 vaccines. There are 4 producers that are already participating in this facility. So all the possibilities to guarantee access are important, because if a vaccine is not the best one, it is important also to have all the other options that could be better for the region. Thank you very much. Thank you very much, Dr. Barbosa. Now we are going to move on to the next question by Jacqueline Charles from Miami Herald. She's saying,
an explosion of cases, as many anticipated. Even with its lack of testing, we are not seeing the evidence on the streets like in Ecuador or at the hospital where beds remain empty. Do you have an explanation of what's happening there? Is there a different, weaker strain of the virus, or can it be the result of some of the local remedies people are taking even when they do get sick? Doctor Ugarte, ¿puede tomar esta pregunta?
Yes, I can. It is true that the number of cases and deaths that have been reported in Haiti during the last 6 months are lower than those expected, according to the models and the information that we had. There are, of course, the epidemic is not over yet. There is still a large proportion of the population that can be infected still. And we are looking for which are the reasons why those numbers are not high in Haiti. There are several things that we don't know yet, and we are actively looking for the information that can lead us to the situation. Still, there are some factors, for example, the age of the population in Haiti, but also the stigma and the discrimination that is being implemented or being actively being seen in Haiti. But also we are seeing that there are some other factors that the population can look at. Still, Haiti has increased its capacity of testing, has increased its capacity of health services. So we are working together with all the partners inside Haiti, the Ministry of Health, the UN agencies, but also other actors in order to be prepared in case the number of cases increase in Haiti. But this is something that is clear. It's important to also to highlight this applies to other countries in terms of the use of non-proved treatments or prevention that may cause more problems than facilitate the recovery of the patients. Thank you.
Muchas gracias, doctor.
Thank you very much, doctor. Now we are going to move on to the next question by Daisy Ortiz from El Deber in Bolivia. She's asking about the percentage of persons that have been affected by COVID-19 that may suffer effects afterwards, and also what are the main secondary effects and what should be done to support these patients, and also what is the impact of the virus on the body that leads to death in people. Dr. Aldigueri, could you please address this question? Thank you. Thank you for the question. The information regarding an important number of cases and deaths in the region, and also the analysis of the information is underway, and we have new evidence every day. A new database is being implemented for the clinical follow-up of the patients, and as to the question and the effects of the disease on people, the most frequent are the ones related to the stay of critical patients in the intensive care units, and also acute respiratory failure, kidney failure, thrombosis, and also septic shock. However, there are complications at the level of the heart, the neurological system, among others, that require greater follow-up in the midterm and research.
I would also like to highlight the importance of ensuring access to the rehabilitation services of patients who had a long stay in the ICU and other clinical follow-up interventions, such as the cardiology aspect, but the follow-up of mental health issues as well. Thank you. Thank you, doctor. And we'll now go to the next question coming from Ariela Navarro from the French agency, who asks, how is the fight against obesity going to, is this pandemic going to affect, and is COVID-19 going to analyze or affect obesity? Dr. Spinel, yes, thank you very much for that question. Under pandemic situations, not necessarily COVID, but we're in the midst of COVID right now, under all pandemic situations, when social distancing is recommended and when stay at home is recommended and avoid large groups, there can be situations where people don't take as much care as they need to consider their diet or leave the exercise or physical activity. So yes, we cannot discard the possibility of finding an increase in obesity in the future as a result of this. That's why it's so important that we always recommend physical activity, even within the house, or a walk or some exercise, and to consider the diet and the food we eat. I think it's very important that we take into consideration that we realize that it can also have an effect on mental health. We mustn't discard the possibility of having an increase in the obesity rates because of junk food or unrecommended beverages. So it is very important that we continue following the recommendations. PAHO has recommendations on its website and follow the doctor's recommendations as well. Thank you very much. Thank you, doctor. I'd like to offer the floor to Carmen Pam from Politico, who would like to ask a question. Carmen, if you're hearing us, you have the floor to ask your question.
Thank you so much for giving me the floor to ask a question. Also, in line with the previous question about consequences of the pandemic, are you seeing any resurgence of other infectious diseases like measles and others that there's already a vaccine for in some parts of the region due to misvaccination that have been caused by the pandemic? And if so, do you have any more information about where they are happening and what are the numbers? Thank you.
Gracias, Carmen. Doctor Barbosa, ¿podría tomar esta pregunta?
Thank you, Carmen. Dr. Barbosa, can you answer that question?
Thank you for this very important question, Carmen. We have see about measles specifically. We still have an outbreak, an ongoing outbreak of measles in Brazil. We are monitoring the coverage levels in all countries in the Americas. We had some discontinuity of immunization services, mainly during the months of March and April and May. Now the services are coming back and we are providing technical guidance to the countries. This is a real risk because we are having millions probably of children worldwide and also in the Americas that are not getting their regular vaccination schedule. So we are accumulating susceptible that can be in a couple of weeks or months or even years responsible for new outbreaks of measles and other immune-preventable diseases. So it's very important that the national health authorities can apply all the protocols to protect the health professionals, to inform the population, but to keep the immunization services as a public health priority program running and offering all the vaccines that are needed. Thank you.
Muchas gracias, doctor. La siguiente pregunta
Thank you,
es
Dr. Barbosa. And the next question is from Danielle Colin from TN23 in Guatemala, who says, in the midst of the economic reactivation, Guatemala is seeing a drop in the number of COVID-19 cases. Is this normal, or could there be an under-registration? What would you recommend to the health authorities, Dr. Ugarte? Thank you, Daniel. The economic reactivation will have an impact in the increase of cases depending on the degree of discipline in the measures for reduction of COVID-19 in the population and the health services, and in general, all the economic activities. In Guatemala, the economic reactivation began about 2 weeks ago, so we may be seeing an impact, if there's going to be, in the number of cases and other signs maybe beginning of September or mid-September. In that case, it would be proportional to the number of cases using the mask, the social distancing, and the hand washing. Of course, the amount of patients that can report being sick so that the isolation or self-isolation or quarantine can begin. So in that respect, the problem for the health sector is that there could be a simultaneous increase in the number of cases that may overload the health services, which may in turn lead to a larger number of deaths due to COVID. So right now, it is indispensable that we intensify the recommendations to the population, that they take all the necessary precautions during this process of economic reactivation, that surveillance continue, the case detection continue, and the suspicious or contact cases, and make sure that the health services are ready for a possible increase in the demand, the emergency services, the ICUs, and so forth. On the other hand, ensure access to information, testing, guidance to all persons showing signs or symptoms. If the persons present symptoms and do not have access to the appropriate guidance or the tests, at this time of economic reopening and more active movement of the population, the virus is going to find an ideal opportunity to spread. So it is indispensable that you not drop the guard and to make sure that this be done safely, not only to improve the economic indicators, but that they also reduce the impact on the health and life of resulting from this pandemic. Thank you, Doctor. The next question is from Kevin Feldmine from the Guardian Media from Trinidad and Tobago, who asks,
Trinidad and Tobago has set up a parallel healthcare system to deal with COVID-19. However, a new wave of spread is swiftly increasing the number of cases in the parallel healthcare system. As of August 24th, there were 919 people in the parallel healthcare system, which has approximately 1,000 beds. Given the mass gatherings leading up the August 10th general election, public health officials are expecting a continued surge over the next week or two. Medical staff have also complained about fatigue, he says. And his questions are, what is PAHO's recommendations to the government if the number of active COVID-19 cases exceeds the bed count in its parallel healthcare system? And also, what advice does PAHO have that can allow the country's commercial activities to continue while decreasing the spread of the virus? Dr. Aldigueri, can you take this question?
Yes, definitely. And thank you for the question from Trinidad and Tobago. This is a situation which is shared by many countries of this region, including other countries in the Caribbean region. And at some moment, I'd like to highlight also one of the comments from our director, Dr. Etienne, at the beginning of this press conference regarding the battery of public health measures and interventions that national authorities have in their hands to take decisions and to implement interventions. Epidata, it's important to monitor epidata, including laboratory confirmed cases, reproductive number of beds for patients with moderate disease, and the number of ICU beds. These are the key indicators for adjusting the public health measures in a country as Trinidad and Tobago, and modulating the offer of health services. This includes, and this should include also, the management and follow-up of patients in alternate facilities and at home in order to relieve the burden on the health services. But at this moment, it's important really to remind you the comment from Dr. Etienne. The interventions as contact tracing, quarantining of contacts, testing of patients seeking care at primary healthcare level, and isolation of cases, these interventions are crucial for flattening the curve. We would like to acknowledge the expansion of the public health laboratory network in Trinidad and Tobago, and PAHO, through its country offices, is ready to assist a further expansion of the laboratory capacity, including at primary healthcare level. Thank you.
Gracias, doctor.
Thank you, doctor. The next question on the chat comes from Linda Stryker from Grenada.
Yesterday, Dr. Tedros said that 172 countries has responded positively to be part of the accelerator. Can PAHO say if all nations of CARICOM has responded positively to the request from Dr. Tedros? And another questions related to the ACT acceleration and to vaccines comes from Svet Lustig from Health Policy Watch. He's asking, given the possibility of reinfection, does PAHO WHO see it as important to include people that recover from COVID in vaccine trials? To what extent is this being done? And also, some scientists have claimed the report raises questions about the durability of immune protection, while others say it suggests a vaccine may be needed to develop stronger immunity. Is there enough evidence to support such claims, given that some important correlates of immunity have been left unmeasured? Doctor Barbosa, ¿podría contestar estas preguntas?
Yes, thank you.
Could you answer that question?
Let me start saying that yes, all the Caribbean countries have expressed their interest to join the COVAX facility and to use the revolving fund of PAHO to make the purchase of the vaccines that hopefully will be available in a couple of months. So in the region of the Americas, almost all the countries have expressed their interest to join COVAX facility. And we do believe that this is the best bet to have equitable access to vaccines. Because as I mentioned before, COVAX facility is sharing the risk among more than 170 countries. So you are not making bilateral agreements with one specific producer that you are not sure that this will be the best vaccine to be used. COVAX facility is dealing with a basket of vaccines, so it's much more easier to find the 1 or 2 or 3 vaccines that will work properly after the conclusion of all the clinical trials. About the reinfection, I just want to highlight what my colleague, Dr. Sylvain Aldigueri, has mentioned. We need to understand better what are the information. We have more than 23 million cases of COVID-19. And we have only so far 2 or 3 cases that were reported as reinfection, that we need to understand better what happened indeed. Is this related with any modification in the virus? Is this a specific situation of the immune system of these people? So we need to understand better. It's very important to report this case as the Hong Kong case was reported in a very complete scientific article. But now we have more than, we have 80 vaccines that are in the phase 3 clinical trials. This phase 3 needed to be concluded while we are understanding better what is happening. But again, let's have the figures. We have more than 23 million cases. We know that in a new disease, a new virus, we need to understand, we need to get all the new evidence, because the virus can change and they change, but Sometimes the change does not make any difference in terms of severity, capacity of transmission, in immune response. So it's very important to get all the evidence, to review it carefully before making any recommendation at this point. Thank you.
Gracias, doctor. La siguiente pregunta es de Nicole.
Thank you, doctor. The next question from Nicole Shapur from Bloomberg News in Caracas, and it says, Venezuela
with less laboratories processing PCR tests in the region. Increasing this testing capacity is one of the main objectives of the agreement sponsored by PAHO and signed with the main political forces. What is the status of the efforts made to increase testing capacity in Venezuela? How has it increased since the agreement was signed in terms of numbers of tests processed per day? Doctor Ugarte, ¿podría tomar esta pregunta?
I can. Yes, there have been an increase in the number of tests, but also the tests have been decentralized and in a couple of other locations. But the number of PCR tests and also the capacity of the laboratories to process those tests are still very low. So the turnaround time to receive the results is extremely high as of today. Because of that, and following the agreement, there was a decision to purchase other types of tests, and we already are in the process to procure those tests. We are purchasing approximately 370,000 reactions of antigen test. That is a test that is cheaper than PCR and also is easier to process and also is quicker. We hope that with this decision, the number of tests will increase in Venezuela. We'll have a better analysis of the situation. Still, we have to, in the absence of tests, it is extremely important to consider that the precautions that the population has to implement at all times is the best way to proceed. Still, of course, it is very difficult to implement isolation, quarantine, and so, particularly for the populations that do not receive social protection and assistance. So in this regards, this is one of the most urgent steps that have been taken together with the Ministry of Health and the National Assembly by PAHO. Over.
Gracias, doctor. La siguiente pregunta.
Thank you, doctor. The next question comes from Matías Loedwig from Medscape, saying that in Argentina, there's growing concern for the situation of the family members who are not allowed to be with their loved ones who are dying from COVID-19 or terminal diseases, alleging the fear of contagion. Is this a concern of PAHO? Is there any recommendations? Dr. Espinal? Yes, thank you for that question. There are recommendations from PAHO, from WHO, regarding the management of cadavers and people who are unfortunately dying from COVID. These recommendations are standard recommendations, international recommendations that have been, in fact, validated in past pandemics like Ebola. It's important to recognize that this is a very difficult situation, and the family members would like to see, most of the family members would like to see their loved ones. The recommendation is that the families be allowed to see the body, but in small groups, not in large groups. And it is a recommendation of doing it always with the recommended personal protection equipment and with the necessary measures such as social distancing, hand washing, etc. But the recommendation is not that they not see the loved one. The international organizations recommend that they do see them, but without funerals, with large groups, since this is a very delicate situation and the management of these cadavers is delicate and requires prevention measures, control measures of the potential COVID transmission and other possible infections as well. Thank you, Doctor. The next question comes from Lidia Lopez from Diario La Prensa from Nicaragua. There's several. She says, PAHO has been one of the actors that have donated medical input to Nicaragua. Do you know how the public health system is equipped? Does it have the PPEs? Are they prepared for a growing peak of COVID cases? It also says that the government announced the hospital community program with several brigades from the health ministry who go to the communities in times when they're expecting an increase. Is this a right move? What would PAHO suggest in this case? And also, she says that in the relaxing of the measures by the citizenry, what would PAHO recommend to people? Dr. Ugarte. When the preparation began in the region for the first cases of COVID-19, PAHO offered technical assistance and sent missions to assess the health services and improve their preparedness and response, as well as for surveillance, epidemiologic surveillance, or the organization of the health services and so forth. Of course, strengthening of laboratories, training, testing, and all that. And PPEs have been donated by PAHO as well as other United Nations agencies. In general, that equipment has been distributed to the health services. Currently, there is no detailed information of the availability. That's why we continue making efforts to mobilize more personal protection equipment because, of course, we have to protect our people who are at the front line in response to COVID. And also with regard to my hospital, my community, PAHO has recommended to all countries that they reactivate the essential health services because it's not just COVID. There are many other problems and health services that should be provided during the pandemic, including extramural activities in all cases. The health staff and the beneficiaries must be protected at all times. And we must avoid agglomerations, large groups, in other words. It's important in that case to hear the recommendations, not only for Nicaragua, but for all countries when there are large groups of people. It's important to take additional steps for protection of the people. And as for the next question of the relaxation of the measures, I think that that's already been answered in detail during this conference. I think it's very important that people with symptoms or with suspicious cases or confirmed cases of the presence of the virus should go into immediate isolation, strict isolation, and the contacts go to quarantine, and of course begin treatment as soon as possible, particularly for those who have other health conditions that may lead to severe situations. The countries have more laboratory tests. Nicaragua is one of the countries who's received more laboratory tests, additional laboratory tests, and we continue with that process while we obtain the precise information. Other sources show that the cases and the numbers are different, and there are some additional details which we must take into account so that the population can take the necessary precautions. Thank you very much. Thank you, Doctor. We're coming to the end of this briefing. We have just a few final questions. Natalia Vitela from Reforma in Mexico says, the health authorities in the country ensure that Mexico, the epidemic is dropping, and would like to know what PAHO thinks about this. And the country has started reopening. Does PAHO believe this is too soon? What are the risks? Dr. Barbosa, can you take this question? Thank you for that question. Since, as our director has underscored at the beginning, we have just a mosaic of situations, even within the countries themselves, the large countries like Mexico or United States or Brazil and others have a movement where provinces and states have better control of the transmission, while there are other provinces or states where they continue with the transmission. That's why it's so important for the national authorities to carefully monitor what's happening. PAHO is offering technical cooperation and supporting the authorities in this analysis so as to adopt the most appropriate measures depending on the situation. In other words, where there is still an increase in the number of cases, all measures must be taken, not only to flatten the curve, but to control transmission. Mexico has adopted a traffic light system that evaluates the situation in the different states. And when they evaluate the last 2 weeks in states where there is a decreased trend, while there's others where there's growth. In Mexico and in all countries in the region, it's important to expand access to tests. Tests are part of a broad package of response, but to be able to test everyone with symptoms is important to recommend the isolation, the quarantine of contacts, and so on. Just like all other PPE measures, social distancing, it's an important package of measures. The director also mentioned that the question of the opening of the economy should be done only in the cities, provinces, or states where there is control of the transmission. There has to be definite, they have to be convinced that that will not increase the transmission. They have to analyze the local counties, they have to have reliable data, they have to have epidemiologic surveillance data, which Mexico and other countries of the region have, an epidemiologic surveillance which is very strong and has been in operation for years in the region. So this, I think, is what has to be done to make sure that the reopening takes place only in those places where they are in full control of the transmission. Thank you very much. Thank you, Doctor. And we're now going to go to the last question. We received several questions about the vaccination, and I'm sure we're going to come back to that next week because of the incredible interest we see from you, including one from Douglas McIntosh from Jamaica Community Services and Juan Pablo de Marco from Diario El Observador from Uruguay. In general, the question is the vaccine situation.
The best way for Latin America and the Caribbean to guarantee access to a future COVID-19 vaccine. Doctora Etienne, ¿podría tomar esta pregunta?
So thank you for what is a very important question. And as Sebastian indicated, we'll go in more details next week. So PAHO believes that vaccines are powerful public health tools that must be affordable and accessible in an equitable manner. And this is the fundamental tenet of the 40-year-old PAHO revolving fund for vaccines as part of our technical cooperation for immunization. So we are working to ensure that a future COVID-19 vaccine can be available to all that need it as soon as possible. So the first step will be ensuring that we have a safe and effective vaccine that is supported by strong clinical evidence. We need the results from clinical trials to determine which of the products currently being developed actually protect from the infection. So there are over 150 vaccines under development. 26 of these are promising, and 5 are currently in phase 2B or phase 3 trials. It's important to note that not all will be safe and effective. We hope that a few will be. So that's why we need global mechanisms that will help us identify the more likely vaccines to be successful and which is based on transparent scientific criteria, and to establish the necessary processes to ensure sufficient manufacturing, a fair price, and equitable access. So we see the COVAX facility as the best option to achieve this. The COVAX facility aims to deliver 2 billion doses of COVID-19 vaccines by the end of 2021 and to guarantee fair and equitable access to all participant countries. Now, no single vaccine as of now is guaranteed to succeed. So this is the real risk of countries that are currently in negotiation and entering into prepayments for one specific vaccine. The COVAX facility offers access to a basket of 10 to 15 vaccines at reasonable prices. So this therefore reduces the risk for any individual country and ensures access for and guarantees access for 20% of the population of participating countries to any successful vaccine within the basket. We believe that this is particularly helpful for countries with small populations, low-income countries, or even middle-income countries. So we are encouraging our member states to join the COVAX facility, which will enable countries to share the risk and allow low and middle-income countries to have early access to the vaccines. So there are 40 countries and territories within the Americas, our region, Latin America, and the Caribbean that have sent written communication indicating interest. As we said yesterday, this will allow us to have a much better chance of equitable access if we work together. The region has one of the highest vaccination coverages in the world, and this is a result of collaboration. Countries pooling our resources and working together to minimize risk through the revolving fund. So we've done this for 40 years, and we are already applying the same experiences to enable future access to a COVID-19 vaccine once we have one that is proven to be effective. Next week, we will have much more on COVID-19 and the COVAX facility. Thank you very much.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne, and thank you all for participating in today's session. We've come to the end of our session, and as usual, shortly we'll be sending Dr. Etienne's opening words as well as a recording of the session. And remember that you can find more information on PAHO's webpage, and you can stay in contact with us via email. We will be answering you as soon as possible. Thank you all for participating, and have a good day.